وبركاته. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. I would like to thank you all for joining this important webinar about workers' rights during COVID-19 crisis. I would like to start by emphasizing that my statements, opinion, and whatever I say today reflect my own and do not represent any of the institutions I'm affiliated with. With that, I would like to welcome our speakers. We have two prominent speakers today, Jessica Cook Quraishi and Jessica Espinoza from DePaul University Labor Education Center. Jessica Cook Quraishi began her work with the center as the lead instructor in January 2016 and became the director of the center in August 2016. Jessica joined the labor movement as a staff organizer and staff union steward at the Unite Here International from 2006 to 2009. She then spent 7 years as a leader and steward with the Graduate Employees Organization, IFT-AFT Local 62097, while working as an instructor in sociology at UIC, where she earned her PhD. She has also worked closely as a volunteer and researcher with multiple Chicago-based worker centers since 2010. Jessica has a PhD in sociology from the University of Illinois at Chicago. Her doctoral research focused on labor movement, worker centers, mass incarceration and criminalization, immigration, citizenship, race and ethnicity, civil society, and labor market restructuring. Please join me in welcoming Ms. Jessica Cook Quraishi. Now, let me introduce her Associate Director, Jessica Espinoza, also from the DePaul Labor Center, joined the center in fall of 2019 as the new Associate Director. Her journey in labor started off as a union state employee while earning her Bachelor of Arts in International Studies and Political Science from Portland State University. Upon completion of her undergraduate degree, she spent the next decade working for various unions, organizing workers across a variety of industries, including the state sector, healthcare, janitorial, as well as communications. Supplementing her union staff experience, Jessica has volunteered over the years with various labor education organizations focused on building and developing leadership among rank and file community and labor organizations. She is also currently pursuing her Master's of Science in Labor Studies at UMass Amherst. Please join me in welcoming Jessica Espinoza. So today, the webinar will address very important issues facing workers in our communities. We have been faced with questions related to whether they need to work, whether they are expected to work, and what protections they have. And with that, I will give the mic to the speakers. And thank you both, Jessica and Jessica, for joining us tonight. And I hope we will all learn from what you say. Thank you.
Thank you so much. Thank you. Thank you. Assalamu alaikum to everybody. Thank you for joining in this evening. I'm going to go ahead and share my screen for the PowerPoint, but I just want to let you know, I know the PowerPoint is very full with a lot of words, so we'll be sharing it with you so that you can, keep track, look at the resources later on. We have a lot of websites listed on there that you can refer to going forward. So we hope this is a resource to you that you can also share with other folks. So we'll share the PowerPoint now, but don't want you to be overwhelmed with the words. We just want to make sure that everything is there for you if you want to look at it later. Let me try to share the screen now. Okay, is it all set?
Yes, beautiful.
Okay, great. So thank you guys so much for the wonderful introduction. Just want to let folks know a little bit about what we do. So at DePaul University Labor Education Center, we challenge each other to consider what else must be done to promote a transformational labor movement. And guided by this mission, we build the capacity of unions and workers organizations through youth and adult labor education, trainings, research, and public events, who share as much information with people, empower people, give them trainings and education, and also create community, make sure that people have everything they need to live their best life. So the things that we'll go over today is, we discussed the introduction. I'm now going to go over the two major recovery bills that just passed recently in the last month, and talk, as you mentioned, about our workplace rights, if your workplace remains open, cuts hours, or closes, and then some tips on how to ensure your rights are respected. And then at the end, we'll have some time for question and discussion. So I won't go over all the details super in depth because, again, you'll have some time to look at it on your own, but I do just want to go over a few things with you about the two new laws that you must have heard have passed. So the first, of course, is the Family First Coronavirus Response Act. And then the main things out of this are the Emergency Paid Sick Leave Act, the Family and Medical Leave Expansion Act, and then making the testing for COVID-19 free, regardless of people's access to health insurance, and increased food assistance. And I just want to make mention that all of these programs are available to immigrants regardless of their immigration status. And I'll make sure to make note of if that varies on other kinds of things. So this law, became effective on the 1st of April, and it, at this point anyway, is continuing until December 31st. So again, for the paid leave portions, which we'll focus on, which I think is probably of most interest to most people, is eligibility is for those who are still working. So if you've already lost your job, the paid sick time and paid leave do not apply. And it's to cover private sector employers with fewer than 500 employees, but that does include temp agencies. Legally, immigration status does not matter. Of course, some employers will respect the law and others will not, which we'll talk more about later. But at least legally, it's for anybody who's working. Healthcare providers and emergency responders may be exempted, and employers cannot discharge, discipline, or discriminate against anyone who takes time off or files a complaint if they're denied it. This is enforced by the Federal Department of Labor, Wage, and Hour. And the way that it works is that businesses are repaid through tax credits. And it can also apply to self-employed workers, for those of you who are self-employed. So the key things here, which is a little different than most other paid sick leave, including that which is passed in Chicago, is that you don't have to have a certain length of time that you worked at a place to be eligible. And it's up to 2 weeks, so meaning 80 hours or your average hours worked if you're part-time, of job protected sick days. And so if there's 6 different provisions with which you can apply, or that this would apply to you, you can get 100% of your normal pay if there is a local quarantine or isolation order like we have in Chicago and Illinois. Or if you've been advised by a healthcare provider to self-quarantine because you have COVID-19, or you're experiencing COVID-19 symptoms and are seeking medical diagnosis. In those 3 cases, you're eligible for 100% of your pay. You are eligible for 2/3 of your pay if you're caring for somebody who is in quarantine or isolation, or quarantine as advised by a healthcare provider. If you're caring for a child whose school or child care provider is closed or unavailable due to COVID-19, which is essentially all children in the state of Illinois right now. And if you're experiencing any other kinds of illnesses that seem connected. For the Emergency Family and Medical Leave expansion, some folks may be familiar with the Family and Medical Leave Act, and that traditionally means 12 weeks of unpaid job protected leave if you have to take care of yourself or somebody else. This is an extension of that connected to COVID-19, where if you are caring for your child whose school or childcare is closed or unavailable, you can take this emergency expanded family medical leave time. It is not for you to take care of yourself or somebody else who is sick. It's just for taking care of your child. And so in this case, you have up to 12 work weeks of job protected leave, where the first 2 weeks are actually not paid, but you could use the paid time off you have from your job already, or the one mentioned in the previous slide. The other 10 weeks are paid at 2/3 of your regular rate of pay. Now, if you've already had to take 12 weeks of FMLA in your allotted period, whether that's the calendar year or rolling basis based on your employer, you cannot extend it. And while this is supposed to cover people who are in a business of 500 or less, some small businesses of fewer than 50 people can qualify for an exemption if letting people take the time off would jeopardize their business. I won't go in depth here, but just to mention, as you may have heard, this, testing with this law makes testing free to everybody. And just for the sake, for immigrants who are concerned about this public charge rule that has come through this administration by being, how do I want to say it, penalized for taking any support from the government and that affecting your ability to regulate your status. This will not, by law, this will not affect that. There's also about $1 billion set aside to help with unemployment and $1 billion to help with nutritional assistance through SNAP. The other law, of course, is the CARES Act. So this is the Coronavirus Aid, Relief, and Economic Security. So there's a few different pieces that people are paying the most attention to for our own families that I'll go over briefly. So there's the 3 different unemployment pieces. There's also the stimulus checks that a lot of people have been talking about. And then there's also stimulus money for large industries and small businesses. Unfortunately, immigrants that do not have a social security number are not eligible for the unemployment programs or the stimulus check. So as I said, there's 3 unemployment programs with this law. They're retroactive to January 27th. So if you already faced unemployment, before this law was passed, you're still able to go back as far as January 27th. Except again, if you don't have a social security number, even if you have an ITIN number, you're not eligible, since per the current US law, those who do not have a social security number are not legally able or available to seek work, which is a requirement for getting unemployment. Unfortunately as well, the stimulus checks that you've been hearing about are not available to people without a social security number. And as I understand it, is also if you have family members that you file jointly with who have no social security number or just ITIN, that means anybody who is part of that tax filing are also not eligible, unfortunately. I'll go through those details a bit later. And just to mention that there was also $46 billion set aside for industry-specific loans, like the airlines and things like that. Another $450 billion to federal research to help with business loans, and $349 billion for lending programs for small businesses to maintain payroll levels. And this one is something that I think a lot of people in our community should definitely check into. I'll come back to that. So the 3 different types of unemployment, there's the pandemic unemployment assistance. So for workers left out of regular state employment or who have already exhausted their regular employment, that's what this would serve, okay? So this means up to 39 weeks available to workers that are not usually allowed or able to get unemployment because they don't fall within kind of the typical employee category. So that's self-employed workers, independent contractors, freelancers, gig workers, right? Like Lyft and Uber drivers, workers seeking part-time, and those who have too short a work history for most other unemployment programs. So if you just started a job, a lot of times you're not going to be eligible for unemployment. So this is trying to fill in that gap for people. At least as of now, it expires in December 31st. Of course, that could change, but that's as it stands currently. And again, it's also for people who perhaps you've already had to use all the unemployment that was available to you if you are a quote unquote standard worker, but this expands the length of time you have access. The pandemic unemployment compensation provides all regular unemployment insurance recipients and people who are able to claim unemployment from this slide I just mentioned. Any of those folks are able to get $600 a week on top of their calculated benefits. So it doesn't matter what your wage is, you'll get your normal calculation based on what you make typically, but then on top of that, everybody who applies and who is accepted will get an extra $600 a week until July 31st. Finally, there's the pandemic and emergency unemployment compensation. So this provides an extra 13 weeks of unemployment benefits for those who qualify for the sort of standard unemployment, right? So that's to extend the number of weeks that the state allows. And again, all unemployment laws are by state, except for this, situation which is federal. This will end on December 31st. So I won't go through it in depth, but just if you are eligible and in need of filing for unemployment, we've included the websites here. And just to mention, of course, as you've probably seen in the news, over 10 million people over the past few weeks have applied for unemployment. I'm sure that number is much higher by now. So there's a lot of folks applying, and given that the offices are a little bit overwhelmed, so they're trying to have people file on specific dates based on their last names. So the information is there for you. And also just to mention that if you lose your job, hopefully not, but if you lose it, tomorrow, you can apply that same day. You don't have to wait a week as you normally would on standard guidelines. Then there's the stimulus check for families that, again, a lot of folks are very interested in. So this is essentially a one-time payment of $1,200 per person for individuals with an adjusted gross income of less than $75,000 or less than $150,000 for joint filers, so like spouses. Those who earn more than that will get something, but it'll be a graduated amount less than that. Unfortunately, though, the ability to receive this is based on your 2018 or 2019 tax filings. So, if you have not filed your taxes yet, as you may have heard, you still have an extension. You have time to do that. And I think they'll refer to your 2018. But again, this only goes to people who are able to pay taxes officially. And even if you have an ITIN number, unfortunately, you will not be able to receive the stimulus. The same goes for the part about the child stipend. So families will also get $500 per child that is reported on their taxes that are under 17 years old. So also youth who are 17 years old and above that are claimed on their parents' taxes, actually neither the parent nor the youth will be able to claim that income, just so you know. There's also, as I said, almost $350 billion of money set aside for low interest loans through the Small Business Administration. So there's a lot of details here for either yourself or your employer or somebody in your community to look into. But essentially, these are loans that are, they can be forgiven if you use the money predominantly to keep your staff. And so there's a lot of room to get the support that small businesses need. I have not applied for this myself, so I cannot say from experience how this is going. I can imagine there's a lot of people applying right now, but I would encourage you, if you're interested at all, to try to do this as soon as possible, because the sooner the better. The higher up in the queue you are, I think will help. But this also, again, works for people who are independent contractors and self-employed. So it's not just, larger businesses. This is, again, another way that those of us who are doing work that may not be as traditional do have some options. And I also just want to mention, this is not part of this law, but Chicago also has some resources for folks. There's a Chicago Small Business Resiliency Fund to complement this Paycheck Protection Program of this bill. So please check out those links if that's something that would apply to you or someone you know. And again, we listed a whole bunch of links. I hope it's not overwhelming, but we just wanted to make sure there's information. On this slide, you've got some more descriptions about the laws, just if you want to look a little deeper. And then also some lists of local and national resources, the last two in particular. So you've got a whole range of different things that apply both to these laws, to your rights, but also to different kinds of assistance you may be eligible for, or food banks, different kinds of things for folks, information about rent and eviction issues and mortgages. So I know a lot of that is a conversation right now too. So these are just some places that you can look into. And then we also included some links that are specific to immigrants and immigrant rights in general, and certainly connected to work, but especially in these times. So again, these are some that we feel are, you know, well-rounded and provide a lot of really important information that we just won't be able to dig into right now. So they're there for you to look at later. Is everything going okay? Everybody hear me okay?
Yes, it's good.
Great, great, great. Okay, I'm going to move on to the next section then. So your rights on the job, workplaces that remain open, cut hours, or close. Okay, so as folks have, I'm sure, heard, right, we have the stay-at-home order that Governor Pritzker enforced starting last month. And in that, there's a distinction between essential and non-essential businesses, okay? And so this is how we're gonna kind of frame this conversation. And again, everything that we're gonna be talking about is both what is on the books, what's official, what's legal, and then also understanding that that's not exactly how our community often works in real life. And so I wanna give tips and you know, space for talking about those things that are a little inconsistent, right? And to give support to folks. So again, the Illinois stay-at-home order, as of now at least, you know, is in effect from March 21st until April 30th. It's already been extended once, but you know, it could be extended again. So just keep that in mind. And so, of course, as folks know, that means we are supposed to be staying home as much as possible, really not going to public places except to, you know, get food and some other essential things, but essentially stay home. That also extends to businesses. So there's a whole list of things, but healthcare, grocery, gas stations, laundry, restaurants for takeout, etc. These are considered essential businesses and are allowed to remain open. All other businesses should be closed unless they are doing minimum basic operations like payroll and like really basic things that have to get done, or have employees work from home, like DePaul, right? We're all working from home right now. All other businesses are supposed to be closed. There's within the order, I've got the link right there, right? You can double check to see if you fall into the category, right? As I understand it though, there are not specific penalties for non-compliance. It does say in the order that there will be enforcement, but I'm not exactly sure how that's going. So just keep that in mind if, as a worker, how that may affect some of the ways that you try to ask for your rights. I won't read it all here, but there's just a couple of pieces from the executive order so that folks can see, but just again, saying that non-essential businesses and operations must cease, and that social distancing is required or expected, right, by the governor. So that includes, of course, at least 6 feet of social distancing from individuals, washing hands with soap and water for at least 20 seconds as frequently as possible, or hand sanitizer, covering coughs and sneezes, requiring cleaning, high-touch services, and not shaking hands. There's more details further on, but you know, this is what the executive order asks of businesses to do. We were going to do a poll, we didn't get around to it, but I'm not sure if this will work in chat, but I'm sorry we didn't go over this beforehand. How many folks are still working? And if you're working, are you in an essential business? You have to work outside of your home? And Jessica, can you maybe take a look at people, put that in the tally and let us know? I'm not sure what's happening with these lines, by the way, these drawings.
So if folks are, this is Jessica Espinoza, if folks are working, which a few people have put in the chat box that they are, please continue to do so. Thank you. And as of right now, the folks that are chatting are saying that yes, they're currently working.
Okay.
Working from home, working as a physician, self-employed, providing after school programs, trying to offer programs virtually.
Great, okay. All right, well, thank you guys for sharing that. It just kind of helps us get an idea of what's out there. I'm not sure, does anybody know why these squiggles are happening on here, on the slide?
Jessica, no, I'm not certain. This is a unique experience, but
Yes.
your information is captivating the attention anyway. So please.
Okay. Okay. All right.
Can I say something? If somebody is able to write on the screen, please do not do that. Seems to me somebody is writing on the screen. I don't know how they have access to it.
Okay. It looks like my daughter is contributing, but she's asleep as far as I know. All right. So to the questions that you guys, what brought you to come here tonight? Do you have to work if your workplace is an essential business? So technically, yes, with all the asterisks, right? So unless you have a union contract, everybody is an at-will employee, and that means you're at the will of your employer. So legally, your boss can ask you to come work and could fire you if you do not, if you're an essential business. That's, again, anybody who doesn't have a union contract that has more protection. If you decide to stay home from work because you feel unsafe to work currently, you could ask for time off using the local paid sick time ordinances that are out there, as well as, of course, these new federal paid sick time and leave acts. You could quit if you feel really unsafe, or if you feel that it's not a situation you want to remain in. You might be able to get unemployment as you make that decision if you have a social security number again, right? If you can show that you had a good cause to quit, if you really thought that your safety was at risk, and if you took the reasonable steps to resolve the problem, right? You tried to talk to your boss, you tried to take sick time, but they wouldn't let you do it. You might be able to get employment. At least, that's the official line, right? And if you have underlying health conditions where you're particularly at risk to contract COVID-19, you could get a certification from your healthcare provider and apply for state disability insurance as an alternative to continuing work. And you do not need a social security number for that. If your workplace is open but is not an essential business, right? So if it's essentially violating the executive order, you could talk to your employer about the need to close down, both legally and ethically, in support of public health, both for yourself and your community, your customers. If they refuse to shut down, you do have the option of making a report that they're not complying with the executive order, if that's what you choose to do. And if your employer fires you for not coming into work in compliance with this government directive, so firing you, even though they shouldn't even be open, you could claim that you're wrongfully terminated and apply for unemployment, again, if you have a social security number. I know those don't feel like probably the answers you were hoping for, and it doesn't seem like there's a lot of options. But again, I'm just, to review it, I mean, this is, unfortunately, in the United States, there's not a lot of other strict guidelines in support of workers in these kind of topics, right? So we'll go into what are the kind of things that, you do have protection, and how we can stand up for that protection, okay? So the general health and safety in a normal, quote unquote, time, right, is protected by the Occupational Safety and Health Act of 1970. And that states that employers have to provide a workplace that's free of hazards, that is likely to cause serious harm or death, right? They have to do appropriate safety training. They have to provide appropriate personal protective equipment. They have to notify employees of hazards, meaning, clear labels on substances, on cleaning, materials, etc. They also have to record and make information available about what illnesses and injuries occur at the workplace. So anybody has the right at a workplace to see what's been going on, right? That's general. Of course, it's hard to enforce. The OSHA, the Occupational Safety and Health Administration, is not well staffed, and it's hard to get into every workplace, right? You do always have the option of calling them and having somebody come in to try to, enforce the laws, but, it really takes each of us to be the ones to enforce our own safe conditions a lot of times, right? In this case, and I'm sorry, I realize now that the bottom of the slide is not showing, but during the pandemic, unfortunately, there's not new laws about our health and safety. There's voluntary guidance and recommendations that have been shared from the CDC and OSHA. So employers are, but also employers are allowed to take employees' temperatures, as well as send employees home if they display symptoms. So that's one thing you can take some security in, knowing that employers can do that, right? They can try to limit the number of sick workers who are at your workplace. So again, I'm just reiterating what I said before. Governor Pritzker's executive order, while it is not a law, so to speak, enforceable directive in a way, he is encouraging essential businesses to enforce, safe social distancing, making soap and hand sanitizing products available, creating different times for more vulnerable and elderly folks to use the businesses, etc. But there's a lot of other protections that we need, right? So both, of course, the protections that are listed out in the executive order, but there's a lot more things that people can do, and some workplaces are doing. And so we encourage more and more, including those of you who are business owners, to do this as well. So of course, frequent cleaning and disinfecting of the workplace, allowing more breaks for workers to clean their hands, staggered schedules for staff, modified hours, limited numbers of workers and customers and spaces for more social distancing, but we don't want that to lead to a reduction in pay. We hope that business owners will be as ethical as possible and make sure that people's paychecks don't decrease, because certainly their bills are not decreasing. And if any of you have tried to go to Costco, for instance, on a weekend, you'll see that they're limiting how many people are in the store at a time. By the very long lines, for example, but that's actually really, it may feel like an inconvenience to those of us who are trying to shop, but it's actually a good effort on the part of Costco and other companies that are doing that to try to protect all of us. Another thing is hazard pay. You may meet some people and they're saying they're getting a couple extra dollars per hour. Those of us in the labor movement do not think that's acceptable. We want folks to have at least 1.5 times their normal salary. And again, these are people who are working, certainly in the healthcare industries, many others, but a lot of us are probably most interacting with people who are at grocery stores or pharmacies. And, folks are putting their lives and the lives of their family members on the line. So we feel like people should be compensated, well, at least 1.5 times the normal salary. So time and a half, so to speak. There also needs to be more safety equipment like masks, gloves, hand sanitizer, and wipes nearby. Face and register sneeze guard shields. You may have seen them in some locations. More trash cans available so people can discard of their tissues more easily, and more soap and running water. We also want businesses to enforce that those who are sick or caring for sick people to stay home. But there's also an important distinction to be made. Most folks who are going to work sick, it's not because they want to. People need to be able to pay their bills, right? So if you're a business owner, make it so that people can stay home and still take care of their families, right? And not be worried about paying rent or buying food or all the other things that we have to take care of for our families. So those are protections. We should make sure that people can stay home, take care of themselves and others, both following the law, but even outside of the law, for us, to hopefully get through this pandemic as soon as possible, right? We also think that the safety committee is really important, and that's at all times, but especially right now. So, something that we recommend you to ask for is a safety committee that includes workers from all shifts and departments to be in conversation with your employer so that folks can decide together what's the most important and most effective means of protecting everybody. So these are just some suggestions. Of course, you probably have many more, and I hope we'll get to that a little bit in the questions. Now, can you refuse to work if the conditions are unsafe? As I kind of mentioned before, legally, yes. OSHA states that you can refuse to work if you reasonably believe that doing so would cause harm to you or others, and if you've made requests for the conditions to be remedied, but the employer did not do so. So you'd have to file a complaint with OSHA in that case. You can also report your employer to OSHA for unsafe conditions and refusal to fix them. But most importantly, we think, organizing with your coworkers is the most effective way to change conditions, right? I also just wanted to mention, I saw on a number of websites that if you are able to show that you somehow contracted the virus while you're at work, you might be able to get workers' compensation. And that's something that people are eligible for regardless of their immigration status. All right, so if your workplace cuts your hours or closes, technically, per the law, employers are not obligated to pay people who are not working unless you're a salaried worker, and that's a whole different set of things. But of course, if you're a business owner, I hope that you do continue to pay people, especially hoping that this is not a long-term situation, but technically they're not obligated to. So that puts those of us who are workers in a little bit complicated situation, but that's just, the way that it is currently legally. There's a difference you might have heard between what folks, there's two different kinds of ways some people are being let go if the business closes or has to reduce their workforce. There's laid off, which means that you're fired officially. It means you could be rehired later. Furloughed, on the other hand, means that you're taking mandated time off that's unpaid, right? With the expectation that you will come back later and not have to be formally rehired. Now, some companies do continue to pay benefits through a furlough, but that's totally up to the company. So if your workplace cuts hours or closes, you can file for unemployment if you're eligible. You can also organize to regain hours to work with the employer to see about options for staying open or to encourage the employers to continuing paying people while closed. Again, here's a whole list of relevant websites, both governmental, advocacy organizations, and some unions that have various information, as well as the site related to all of these things that I just mentioned, as well as more information on your health and safety rights in general, and then specifically now. So I definitely encourage you to check out some of those. Now, how do we ensure that your rights are respected? I just listed the relevant governmental organizations that are, of course, always welcome and able to reach out to if you're finding some violations. Again, as a labor education center, we'd encourage you to try to work within your workplace and with your coworkers to try to make the changes that you need. So we'll just mention, I see now the time is getting away from me, but the first thing is unify with your coworkers and go to talk to your boss, right? We hope the boss at your workplace, if you're still working, will be amenable and, listen to your concerns. That is always the hope. And if not, having more people coming together, you're more likely to see the results that you would want. So just Section 7 of the National Labor Relations Act, I'm going to read this because this is very important that people understand more broadly. Employees shall have the right to self-organization, to form, join, or assist labor organizations, to bargain collectively through representatives of their own choosing, and to engage in other concerted activities for the purpose of collective bargaining or other mutual aid or protection. And that applies to all workers, regardless of immigration status. There are some exceptions in terms of occupations. That includes domestic workers, agricultural workers, independent contractors, family members, and supervisors. But some people do organize, particularly you may see some organizations like the National Domestic Workers Alliance, right? People do still organize, but they're not technically protected by this law, right? So this is the law that allows people to have a union, but this is, again, the important thing is that other concerted activities, even if you're not in a union, it means that all workers are protected, even if they're working together. In this case, a concerted activity is a collective effort to improve the working conditions for all employees, where the employer knows about the activity. It does have to be like a public activity, so to speak, and that there's a clear demand, okay? So even if you don't have a union and you talk on behalf of your coworkers or with your coworkers saying that you need something, you are protected from being retaliated against or fired by the law, okay? So this means that, if you want to improve working conditions, you are legally allowed to talk openly about pay and benefits and working conditions, to join with your coworkers to talk about your employer, to circulate a petition, right? To distribute flyers, to refuse to work in unsafe conditions as a group. You can also walk off the job and protest. You can participate in press conferences or rallies. You can also form a union and recruit your coworkers to join, okay? Now there's a lot of details that I'm happy to talk with people, including like if you're circulating a petition, for instance, you need to do that on non-work times and non-work areas like break rooms or away from work, for instance. But this is just some ideas. I do just want to mention in the age of social media and access, more access to media, we definitely do not recommend that you speak badly about an employer or their product or tell customers not to come, but you can say, as you're seeing a lot of nurses around the country say, that your particular workplace is not doing enough to protect yourselves as workers or the public. And then I put a link here from Labor Notes, which is the organization that collects a lot of information, does webinars, keeps up with labor stories. Just a lot of good resources there. They have a short piece that's called Can I Get Fired Talking About the Virus Risks? And so if you want to go a little deeper, that's a good thing to read. So if you do decide to take some steps to try to change your working conditions, you can talk to your coworkers and make a contact list to stay connected. Identify a set of immediate, pressing, and realistic demands, because we know it's a really complicated time. But there's a few things you could still, very validly ask for, like increased pay and protections, like we've talked about. Also, adherence to these new laws and the local sick time laws. You could ask for continued benefits, right? Or a clear plan if there is layoffs or furloughs. And also help being able to take care of other benefit programs that are out there. During the questions time, I'll see, if people have other ideas, I'd love to hear them. So once you've identified a set, you've talked with your coworkers, a set of demands rather, and talked with your coworkers, ask for a meeting with your employer. Go as a group and have some of your respected coworkers as the spokespeople on behalf of the group. Ask them to make these changes, see what they're thinking, see where they're at, see what other challenges they're facing, and how you can work together or how you can make this happen. You can also share links with them from this PowerPoint, from other things about the business loans out there to help with payroll, etc. They may not know about these things. This is all still really new. So much is changing. So give them the benefit of the doubt and share this information with them. They may not know about these new laws. They're really complicated. So you can say, hey, actually, there are these sick laws. I really hope you'll adhere to them. If they don't, address your concerns or, hear you out, your options are to increase the pressure a bit. So you can bring a flyer, letter, petition with your demands, signed by a majority of the workers. You can go to customers or the media to share these demands. You can get a petition of support by community members and leaders. You can also withhold your labor by going on strike. These are some options. This is a very quick description of some of your options. I'll spend a whole semester talking about the details, but I just want to make folks familiar with some of these things. For more information to talk about these, you can talk to the Chicago Federation of Labor, which has a full list of unions for all the different industries that are out there, and other resources. Raise the Floor Alliance is the worker centers coalition that there's 8 different worker centers that work in areas that are less often organized by unions, but still need advocacy, like domestic workers and temp workers, etc. And then of course us, which I'll come back to again, but I want to be a resource to all of you and I want you to stay in touch with us if we can be helpful at all. I just put in here that there is examples of successful organizing that's been happening already just in the past couple of weeks that I think are really inspiring. I put the link at the bottom so you can read a little bit more. Certainly there's been expansion of rights and protections in places that are already unionized. You may have seen a few days ago, UIC Hospital, the workers there are organized, they have a union and they were able to enforce their contract and get some better protections. But there's a lot of places where people are not unionized, that they're still making changes in their workplace by standing together, by talking to their by talking to their employers, asking for these things. And if the employers don't comply, then they put on more pressure like we talked about. So I know, I didn't talk much about this in my bio, but I'm very aware that I should have put this at the beginning, but I know it can be very complicated in our communities, especially a lot of times we work with folks that we know, we don't want to cause trouble, and I understand all of that. I know it can be very complicated, but we also have the obligation to ourselves and to our family members to try to protect ourselves and to make sure we have what we need. And so we hope that even if you work in a place that, maybe it's a distant family member or friend of a friend that you work for and it can feel uncomfortable, we understand that. And we just want to encourage you to work together. And if you're a business owner, to work with your workers to try to make this as less difficult as possible in these really trying times. Understanding that everybody's going through a hard time, but trying to make the best situation for everybody. Again, here's some more information of how you can protect your rights. Other examples of, kind of details. I included a couple for cashiers, for healthcare and childcare workers, examples of how people, different kinds of regulations and protections people are asking for in specific industries that you may want to look at. And then there's some other specific information, or I'm sorry, more general information after that. Again, I just want to encourage you to please stay in contact with us. Again, you know, you can get through CIOGC, you'll get this PowerPoint, but also, you know, check us out on our webpage, on Facebook, Twitter. We're also sending out weekly emails that list out new resources, new information that we're finding out each week. So please feel free to email us so that you can get on our listserv as well. So from there, I know we're running out of time, but I'll pass it back so we can take some questions.
Thank you, Jessica, for this very informative webinar so far. And we have some questions. Can you hear me?
Yes, yes. I was just trying to get out of the chair.
Yeah, we have some questions. Jessica Espinoza have been trying to answer. I have a question for you. For self-employed workers and freelancers and independent contractors, you said they're also eligible for pandemic unemployment assistance up to 30 weeks. So what is the criteria? Do they go with their average income over a certain period of time? How would the government determine? And you know, you have self-employed, you have one person, sometimes it's not a big company, it's just somebody working from home. How do they go about that, and who qualifies and who doesn't? Can you speak to that?
Yeah, I mean, I would just encourage folks to go to the website, to be honest, because I know there's going to be a lot of details that are specific to the kind of work that you do. So I'm sorry, that's not a very specific answer, but it's just to let you know that it's worth your time to check out, to see the details, reach out to the state on the links that I provided. And because again, I'm not sure how long certain things will take, given there's a really significant influx of folks looking for these things, but just that it's out there.
Okay. Very good. I have another question for you.
Sure.
For the audience, if you have a question, please feel free to raise your hand or to type the question in the chat window. We have a question from Ikra. Let me unmute you. Or you can unmute yourself, I guess. Brother Mitchell, can you unmute Ikra Azhar? I think he raised his hand.
Okay. Actually, there's a few people using my link, so I think they're all didn't realize that. So whoever had a question, unmute yourself.
Raise their hand.
Raise your hand, right.
Down on the screen at the chat, it gives you an option of raising your hand. That way we can identify the person.
Yeah, go ahead.
In the meantime, while we wait for that, some of the questions, Jessica, if we go back to the earlier part, there was a person who experienced, tried to get the drive-through test for the COVID-19, and they were charged. What options are available to them to, still secure that testing without having to pay?
First I would call, I'm not really sure exactly the best website, but, call the local, if it was in, Cook County or in the city, the public health department, and double check on what happened and try to see what are some of the, remedies that are available. Also, it might be depending on when that person got tested, but I would start with the, public health department, follow up on that.
As a quick follow-up question to that, there was a question, Jessica Espinoza mentioned that you could secure the testing if you meet CDC criteria. Could you share with the audience what those criteria are to inform the audience if they were seeking to get testing? What are those criteria they need to meet?
Jessica, do you want to answer that?
Yeah, if you want to just come back to me, I'll pull up that information and I can share that with folks.
Okay.
Thank you.
And just generally, as I understand, just, you know, still the question they're asking, you know, have you come into exposure with other people that have been confirmed? Have you traveled? Those kind of questions, at least until a couple weeks ago, were still the ones that were usually being asked before you could get tested.
All right. Another quick question, going at the earlier part of your presentation, when you were speaking about food assistance.
Mm-hmm.
Now we're aware that there are certain tightening of restrictions to get SNAP benefits. Has this new legislation, how has that impacted that? Have they been relaxed? Have they changed, or they remain the same?
As far as I understand, it's you know, some changes to it, but also just an increase in what's allowed. So again, I'm sorry guys, I'm not an expert on these laws, much past what I've shared. I just wanted to give an overview. That's why I'm very sorry about that. Hopefully the links, the various links, you'll be able to find more information. Also check out the SNAP website. I'm noticing most websites are doing a really good job of updating. But if you aren't able to find information, I'm happy to dig in farther for you. So if you still have these questions, we can dig in more. I just don't have that.
Can I follow up or ask a question? You know, as I'm watching the presentation, there's a lot of information, and for many of us, could be overwhelming just
Sure,
to know where to start.
Yes, yes.
So if you want to give a practical advice for somebody who doesn't really want to read a ton before they file something,
Sure.
are there any entities or nonprofit organizations that people can call?
Yes.
And they would walk them through, you know, they would answer their questions and see if they have a legitimate concern, and they can guide them through the process. I think that would be very helpful.
Yes, I mean, first of all, I think start with, you know, of course, if you're in Bridgeview or some of these other areas, I would encourage you check with your local, you know, departments. But of course, Chicago and the City of Chicago links that I shared, those are really thorough with those details, as well as, I know there's a lot of links, I'm sorry guys, but looking up specific about, you know, if you have a SNAP question, whoever you normally go to get those benefits, I would encourage you to call them and follow up and get those details. Because, you know, things are changing so quickly. And I think the more that you can go to the source that you already may have a connection with is a good place to start. And if you have never taken those benefits, for instance, you know, I can help you, you know, email me, I can help you find your local number. We can help you with that. Part of it is, I'm sorry, it's this is part of the difficulty. There's so much information and so many details that are changing. So I completely hear you and affirm there's a lot out there.
And if I could add to that, one of the links that was shared in the chat was for folks that are in the Chicago area. So in terms of one of the questions about when to seek care, there's folks that are more at risk. So it's a really quick handout. It's 2 pages. I would print that because it includes the emergency warning signs. Right. If you can print it. But really, people that are over the age of 60, they're at the highest risk. In addition to the age category, it's also people, regardless of age, doesn't matter how old you are, that have underlying health conditions. So if you have diabetes, cancer, chronic lung disease, you're more at risk. So if you are in one of these categories, you should seek medical care early, even with mild symptoms. Whereas if you're not necessarily within these higher risks, then there may be you may get bumped down the line in terms of priority for testing. And then there's the emergency warning signs. So if you have difficulty breathing or shortness of breath, persistent pain or pressure in the chest, if you have difficulty awaking somebody else, is somebody in your home, bluish lips or face. This is all on that handout. So, you know, some of the things that we do know is for folks that end up getting sick, you know, and I know we have a doctor that's in the chat as well, who, if they have additional information to share, it'd be great to hear from them. But there are some people that are more at risk. So you also don't want to wait too long, right? So those are the emergency warning signs. That handout also includes, if you don't have a doctor, that you can go to community health centers. And for those community health centers, and it includes a map, it includes contact information on that link, then patients won't be turned away, even if they can't pay. So that is one link in particular. Even if you can't do all of the reading, you really need to be able to know, what are the emergency warning signs? Are you more at risk, or is somebody in your household more at risk? And where can you go without having to worry about the cost?
Jessica, another question that has come up on the chat is to the, could you once again repeat what the qualifications for, or the procedures for those who are self-employed to get family leave?
Yes, sorry, I'm trying to bring up the slide. So this would, for that, it's actually a tax credit. So if you're self-employed, going through IRS and getting the tax credit is the way that you would be able to get that. So it's not the most ideal and direct, but that's the way that you'd have to handle it. Jessica, do you want to add to that at all?
No, that's right. It'd be the tax credits.
Yeah.
Thank you.
So again, guys, I did see that there was one. I'm not very good at reading the chats as I'm talking, but I did see, you know, some folks, you know, have been told that their pay is going to be cut, even if they're, you know, in a professional field or in, you know, the essential businesses. Unfortunately, you know, I know this is not necessarily what people want to hear, but these laws help. They are something, but they're not enough, as we know. For instance, that tax credit, you know, certainly that's better than nothing. But, you know, Jessica and our work is, you know, especially focused on trying to help people stand up for their rights, those that we have, but also asking for more rights. And so, you know, I just want to encourage people to reach out for support. It's an unprecedented time. Those of us who are maybe very comfortable usually with confrontation or asking for things, it's a different time right now. So it's going to take people asking and standing up and pushing back. And I know that that's not something that most of us do. Including making sure that our states, you know, our local, our, you know, municipal, state, you know, federal government continue to give us more relief. I just want to encourage that as well. I think it's going to be important for those of us who, I just talked to a colleague today and said, well, I haven't applied for unemployment yet. And I was like, you've got to apply, you know, get what you need, but also we need to make sure that people are seeing the full weight of this pandemic and that it's affecting so many of us, so that we make sure that we get the resources that we need as a community.
Kamal?
Okay, with that, I would like to thank our speakers and thank you all for joining this webinar. And I hope we can follow it up with more information. If you signed up through the link or provided your email, you should be able to get a copy of this presentation, and we'll make sure we email it to you. Again, thank you so much. I know there's a lot out there, a lot of information, but hopefully once you receive the slides and going through it, Jessica, the two Jessicas actually from the DePaul Labor Education Center are more than willing to take your questions afterward via email. Please feel free to contact them. They are there to support you. I know we have also several nonprofit social service organizations who might also be able to help you if you feel overwhelmed with all this information and with all the links. Again, thank you so much. Jazakumullah khairan for joining, and please stay safe and stay healthy, and we'll go through this together, inshallah. Thank you.
All right. Thank you, Kamal. And then we'll all turn the floor over to Rashad Khan, the chair of the Council of Islamic Organization, for his closing remarks.
Thank you. Thank you for everyone joining. Thank you for the presenters, especially Jessica and Jessica. You were amazing. A lot of good information was shared. But this is not. This is very relevant topic for all our listeners. So CUIGC is hosting these webinars twice a week. And we have done a few webinars in the past, and e-learning, and what is up now is Sunday we're having another webinar at 11 a.m. Which is focusing on the small business SBA and then PPP that you just talked about briefly. So that's one thing coming up. And then on next Wednesday, we have another webinar hosted just for those who has lost their jobs. How are they applying for unemployment? What are the benefits applying for unemployment and when they need to apply? I think some of that you already covered today, Jessica, but we are getting into more logistics of it, where the application resides, where we can go and get some help, and what are those options available for those who are unemployed. Along with that, we also have a panelist on Wednesday who's going to speak about enhancing the work skills. So if you are in a job market and if you are unemployed and if you are looking for a job, what are the unemployment benefits, number one. Number two, how you can enhance your skill set. So that is the panelist that is going to have next Wednesday. So stay tuned, and more to come. And our goal is to provide this relevant topic for our community. And I really want to thank all those who joined today. Continue to stay tuned with CUIGC, and more to come. So thank you all, and thank you for joining, and stay safe. Assalamu alaikum.
Thank you all for having us. Thank you. Masalama.
And as a final remark for all, please follow us on our website and our Facebook page, and like us. We'd appreciate it. Thank you much. Good evening. Assalamu alaikum.
Bye-bye.